Hey everyone, it's Dr. Stephen Osen, and I'm so glad you're joining me today. We're going to be talking about something that affects millions of people every year, especially us women: urinary tract infections, or UTIs. Now, UTIs might not be the most glamorous topic, but they're incredibly common, and it's so important to be informed. We're going to break it all down: the causes, the symptoms, the treatments, and most importantly, how to prevent these pesky infections from disrupting your life. So whether you're dealing with a UTI right now, have experienced them in the past, or just want to be prepared, this video is for you. Let's get started. Let's start with the basics. A UTI happens when microorganisms, usually bacteria but sometimes viruses or fungi, find their way into your urinary tract. Now, your urinary tract is like a superhighway for, well, urine. It includes your kidneys, ureters, bladder, and urethra. UTIs are classified by where the infection sets up camp. A lower UTI affects the bladder, that's called cystitis, or the urethra, known as urethritis. An upper UTI, on the other hand, affects the kidneys, which is called pyelonephritis, or the ureters, those tubes connecting your kidneys to your bladder. No matter where it is, a UTI is no fun and needs to be treated. So, what causes these unwelcome visitors in your urinary tract? Well, most of the time it's bacteria, and the most common culprit is a bacteria called E. coli. You've probably heard of it. It lives in our gut, and sometimes it ventures where it shouldn't. E. coli is responsible for about 80 to 90% of UTIs, but other bacteria can also be the cause, such as Klebsiella, Proteus, and Staphylococcus saprophyticus. In some cases, fungi like Candida albicans can also lead to a UTI. And while rare, viruses can also be the culprit, especially in people who have weakened immune systems. Now, some of us are more prone to UTIs than others. Ladies, I hate to break it to you, but our anatomy makes us more susceptible. Our shorter urethras make it easier for bacteria to travel to the bladder. And speaking of anatomy, men, if you have an enlarged prostate, that can also increase your risk. Other risk factors? Sexual activity, especially frequent or intense activity, can introduce bacteria. Menopause can also play a role, as reduced estrogen levels can affect the urinary tract's natural defenses. Catheter use, especially long-term, can increase the risk, as can anything that blocks the flow of urine like kidney stones. Chapter 4. Spotting the signs. Symptoms of a UTI. Now, how do you know if you have a UTI? It's important to recognize the signs early so you can seek treatment promptly. Well, our bodies usually give us some pretty clear signals. These symptoms can vary depending on whether the infection is in the lower or upper urinary tract. If you have a lower UTI, affecting your bladder or urethra, you might feel a frequent, even urgent need to urinate, even if very little comes out. This can be quite uncomfortable and disruptive to your daily routine. You might also experience a burning sensation when you pee, which can be quite painful and alarming. Additionally, your urine might look cloudy or have a strong, unpleasant odor. These changes in your urine are key indicators that something is not right. Sometimes there's even blood in the urine, which is called hematuria. This can be quite shocking to see and should prompt you to seek medical attention immediately. And ladies, you might feel pain in your pelvic area. This discomfort can range from mild to severe and can affect your daily activities. Upper UTIs affecting the kidneys and ureters often come with more generalized symptoms like fever, chills, and a feeling of being unwell. You might also experience pain in the back or side, nausea, and vomiting. These symptoms indicate that the infection has moved beyond the bladder and is affecting your kidneys, and just feeling plain old tired and unwell. This fatigue can be overwhelming and make it difficult to carry out your usual activities. Recognizing these symptoms early can help you get the treatment you need to feel better. Chapter 5. Getting the right diagnosis. If you suspect you have a UTI, don't just brush it off. Ignoring the symptoms can lead to more serious complications. The first step is to see your doctor. Early diagnosis and treatment are crucial. They'll ask about your symptoms, medical history, and do a physical exam. This helps them understand your condition better. The most common test is a urinalysis. It's a quick and non-invasive test. It's a simple test that checks your urine for things like bacteria, white blood cells, and blood. These indicators help pinpoint the presence of an infection. If the urinalysis suggests an infection, your doctor might recommend a urine culture. This test is more detailed. This test identifies the specific type of bacteria causing the infection, which helps guide treatment. Knowing the exact bacteria can help in choosing the most effective antibiotic. In some cases, especially for recurrent or complicated UTIs, your doctor might recommend imaging tests like an ultrasound or a CT scan to get a better look at your urinary tract. These imaging tests provide a detailed view, and for really stubborn, recurrent cases, a cystoscopy might be needed. This is usually considered when other tests don't provide enough information. This procedure allows your doctor to examine the inside of your bladder using a thin, flexible tube with a camera. It provides a direct view and can help identify any abnormalities. Chapter 6. Treatment options for UTIs. The good news is that UTIs are treatable, and most people feel better quickly with the right care. For uncomplicated UTIs, those affecting the lower urinary tract, antibiotics are the go-to treatment. Your doctor will choose the best antibiotic based on your specific situation, but common options include trimethoprim sulfamethoxazole, nitrofurantoin, fosfomycin, or ciprofloxacin. Now, while you're on antibiotics, it's important to finish the entire course as prescribed, even if you start feeling better before you're done. This helps prevent the infection from coming back. Along with antibiotics, your doctor might recommend over-the-counter pain relievers like ibuprofen or phenazopyridine to help ease any discomfort. Okay, so we've talked about what UTIs are, what causes them, how to recognize the symptoms, and how they're treated. But wouldn't it be great if we could avoid them altogether? Well, the good news is that there are things you can do to significantly reduce your risk. First and foremost, stay hydrated. Drinking plenty of fluids, especially water, helps flush bacteria out of your urinary tract. Next, practice good hygiene. Ladies, this means wiping from front to back after using the toilet to prevent bacteria from spreading. And speaking of hygiene, urinating after sex is also a good idea to help remove any bacteria that might have been introduced during intercourse. Chapter 8. More prevention tips. Now let's talk about things to avoid. Douching can actually disrupt the natural balance of bacteria in your vagina, making you more susceptible to infections, including UTIs. It's also a good idea to avoid harsh soaps or bubble baths in the genital area, as these can also be irritating. Some people find that probiotics, which help maintain a healthy balance of bacteria in the gut and urinary tract, can be helpful in preventing UTIs. And you've probably heard about cranberry products. While the evidence is mixed, some studies suggest that cranberries may help prevent bacteria from sticking to the bladder lining. Chapter 9. Complications when UTIs turn serious. Now, while most UTIs are easily treatable, it's important to take them seriously. If left untreated, UTIs can lead to some serious complications. One of the most concerning is kidney damage, which can occur from recurrent or untreated kidney infections. In severe cases, a UTI can even lead to sepsis, a life-threatening response to infection that requires immediate medical attention. For pregnant women, UTIs can pose risks to both mother and baby, including an increased risk of preterm labor or low birth weight. And finally, recurrent UTIs can sometimes lead to urethral narrowing or stricture, which can make urination difficult. Chapter 10. Special considerations. Now, UTIs can affect anyone, but there are some special considerations for certain groups. These considerations are crucial for ensuring proper diagnosis and treatment. In children, UTIs can be tricky to spot, as the symptoms might be different than in adults. Unlike adults, children may not be able to articulate their discomfort clearly. Fever and irritability can be signs of a UTI in kids, so it's important to see a doctor if you suspect something is wrong. Early detection can prevent complications and ensure effective treatment. During pregnancy, UTIs are more common due to hormonal and anatomical changes. These changes can make pregnant women more susceptible to infections. It's crucial to get diagnosed and treated promptly with antibiotics that are safe for both mom and baby. Untreated UTIs during pregnancy can lead to serious complications, including preterm labor. And while UTIs are less common in men, they're often associated with prostate problems. So it's important to get checked out if you experience any symptoms. Men should be aware that symptoms like frequent urination or discomfort could indicate a UTI or other underlying issues. Outrow, stay informed, stay healthy. So there you have it, the ins and outs of urinary tract infections. Remember, UTIs are common, treatable, and often preventable. By knowing the signs, taking steps to lower your risk, and seeking prompt medical attention when needed, you can keep your urinary tract healthy and happy. And as always, if you have any concerns, don't hesitate to reach out to your healthcare provider. Thanks for watching.